The Harvest Technologies Bone Marrow Aspiration Concentration System, also called BMAC, has been designed to automate the steps for the concentration of stem cells and proteins from autologous bone marrow aspirate. Bone marrow aspirate concentrated stem cells, prepared by centrifugation, have been shown to optimize conditions for bone healing when combined with bone graft substitutes. The following video will provide the viewer with instructions and protocol to utilize the Harvest SmartPrep centrifuge system and the associated sterile disposable bone marrow aspirate concentration kit called BMAC-2. The instructions shown in this video will help the user to become more familiar with using the Harvest BMAC 60 ml and 120 ml kit for the following. First, the handling and preparation of the sterile disposable components used within the OR sterile field. Second, the aspiration of a sufficient volume of bone marrow and the suggested technique to help assure a viable bone marrow aspirate is harvested. Third, the proper handling of the sterile components used for the centrifugation and processing of the bone marrow aspirate to produce a bone marrow concentrate or BMAC. And fourth, the resuspension and recovery of BMAC with guidance for adjusting BMAC final volumes. The Harvest PRP separation system is designed to be used for the safe and rapid preparation of autologous platelet-rich plasma, PRP. The SmartPrep system uses an automated dual spin and decanting process coupled with self-calibrating floating shelf technology in the process disposable to automatically optimize platelet recovery. The PRP can be mixed with autograft and allograft bone prior to application to an orthopedic surgical site as deemed necessary by the clinical use requirements. The required volume of anticoagulated blood is slowly injected into the red port of the processing disposable. Once filled, the processing disposable is placed into the rotor bucket in the vertical position. The appropriate counterbalance is placed in the opposing rotor bucket. Once the lid is closed, the start button is pressed, and the centrifuge begins to accelerate. The machine is automated to perform 2 spin cycles in 14 minutes. During the first automated 4-minute spin cycle, the processing disposable sits horizontally in the rotor bucket. The floating shelf calibrates itself based on the patient's blood characteristics. The floating shelf rises to a level just below the buffy coat red blood cell interface to automatically optimize platelet recovery during the initial fractionation step. Following the separation of the plasma from the red blood cells, the centrifuge slows, allowing the platelets, growth factors, and plasma to automatically decant into the plasma chamber. When the plasma decant is complete, the centrifuge automatically accelerates, starting the 10-minute second cycle, which forms a pellet of platelet concentrate in the bottom of the plasma chamber. The centrifuge stops, and the buckets return to the vertical position. Approximately 2/3 of the platelet-poor plasma, PPP, is removed using the syringe that has yellow spacers. The plasma is aspirated into the syringe until air bubbles are seen. The platelet concentrate syringe, which has a blunt needle and no spacers, is used to withdraw the remaining plasma and platelet concentrate from the plasma chamber. The plasma and platelet concentrate is aspirated into the syringe and re-injected into the plasma chamber to mix the sample. This process is repeated until platelets are visibly resuspended in the plasma. The total volume is then withdrawn into the syringe. This creates an autologous platelet concentrate enriched with growth factors, which is now ready for application. The Harvest AddiPrep Adipose Concentration System is designed for efficient concentration of autologous adipose tissue for use in medical lipograft procedures. In less than 10 minutes, the AddiPrep system generates concentrated adipose tissue from a sample of lipoaspirate, while removing contaminants such as inflammatory oils and lipids and infiltrating fluid. The resulting purified adipose concentrate can then be utilized for clinical lipografting procedures such as facial contouring. Recent studies indicate that refinement of lipoaspirate prior to implantation may promote graft retention, leading to improved clinical reproducibility and better aesthetic outcomes. The AdaPrep adipose concentration system is intended for use in the following surgical specialties when the concentration of harvested adipose tissue is desired: arthroscopic surgery, gastrointestinal surgery, general surgery, gynecological surgery, laparoscopic surgery, neurosurgery, plastic and reconstructive surgery, thoracic surgery, and urological surgery. AdaPrep technology is based on a proprietary floating lipid barrier disc built into the processing disposable, which efficiently separates oils and lipids from adipose tissue within the lipoaspirate sample after processing on the Harvest SmartPrep system. After lipoaspirate addition, the processing disposable is loaded into the SmartPrep centrifuge for a brief 4-minute centrifugation. During processing, the lipoaspirate is separated into 3 distinct fractions based on their individual specific gravities. The infranatant fluid is the densest fraction and thus settles at the bottom of the disposable, followed by the concentrated adipose tissue fraction. The lightest fraction, the lipids, settle above the floating lipid barrier disc. Upon processing completion, the infranatant fluid is expelled from the disposable, exposing the concentrated adipose fraction for collection and ultimately clinical application.